Okay, this is where I would ask if you have any questions, but since we're not live, we'll just move on. All right, so this is review, these anatomic terms. You should already know these terms. You've been using them with kinesiology for the last, 12 weeks, 13 weeks. So you should know where the midline of the body is, what medial and lateral are, proximal and distal, right and left, hopefully. Superior, inferior, ventral, right, being on the anterior surface, dorsal, being on the posterior surface. When I'm teaching this to the day class, I usually try to draw a shark because sharks have ventral fins in the front and dorsal fins on their back, the one that goes jaws. That's the dorsal fin that you see sticking up. The only problem is I'm a really terrible fine artist, and my fish, my shark usually ends up looking kind of like a baseball bat with fins. So just be glad I'm not drawing this. Okay, body planes, again, I'll review. So we have the sagittal plane, which divides the body into right and left sides. Who remembers which plane divides the body into equal right and left sides? That's right, it is mid-sagittal. Mid-sagittal, the mid-sagittal plane lines up with the sagittal suture, which happens to line up with my part quite nicely. You guys got to see all my lovely white hairs in quarantine. Mid-sagittal divides the body into equal right and left halves. Sagittal just divides the body into right and left portions or sides. Okay. Who remembers what movement takes place along the sagittal plane? Right. Flexion and extension. Remember, flexion and extension take place along that sagittal plane. So if you can imagine there's a board going down through you and the only way you can go is along that board, it would be flexion and extension. Flexion and extension. The transverse plane, remember, divides the body into upper and lower portions, not necessarily halves. Again, it can be anywhere. The transverse plane provides what movement? Rotation. Rotation occurs along the transverse plane. Good. Which leaves us with the frontal or coronal plane. Yes, we know all about corona right now, don't we? Because we are in the midst of a coronavirus crisis. If you remember, the frontal plane divides the body into front and back portions, and typically will line up with the coronal suture. If you remember, corona means crown. So right here is where a crown would sit. Therefore, that is the name of that suture, coronal suture. Oh, makes sense. All right, so what movement occurs on the frontal plane? Yep. Lateral flexion. Yes, excellent. Okay. Body regions. This is all review. You've already had this. A fun exercise to review body regions is to have somebody who is obviously quarantined with you do a Simon Says game and call out body regions that you then have to point to or indicate. Like Simon says, point to your antecubital region, which is here, right? Simon says, point to your orbital region, which is here. You know, that's just another fun way of reviewing this info. It's a little less boring. Okay, Rachel has a cut on her leg just above her ankle. The injured area is A, distal to her knee, B, proximal to her knee, C, anterior to her knee, or D, medial to her knee. What do you think? Good. Yeah, the answer is A. You knew that, I know. All right, so here we have something that's kind of new. We haven't really talked about body cavities before. We don't really focus on them a whole lot in massage therapy, but you do need to know what they are and where they are. So the body cavities are divided into two major cavities. That would be the dorsal cavity, that's kind of the whole brain and spinal cord area, and then the ventral cavity, which is the thoracic and abdominal pelvic cavities. So it's kind of everything on the front then. They can be further divided into the abdominal and the pelvic cavity. Although there's no real dividing line here, it's not physically present, there is a dividing line between the thoracic and the abdominal pelvic cavity, and that is the diaphragm. It is a physical division between those two cavities. The dorsal cavity can be divided into the cranial cavity and the spinal cavity, and there's no division between those actually at all. The brain goes into the spinal cord, which goes all the way down to about L1. If we take a look at the ventral cavity, again, we can see that you can further subdivide it. So you have the abdominal cavity and the pelvic cavity. Again, there's no physical dividing line here, that's arbitrary, made up. Within the thoracic cavity, you actually have two distinct cavities. You have the mediastinum, which is where the heart is, and you have the pleural cavities, which encase the lungs. So these are not empty by any means. The pleural cavities, of course, contain the lungs, plural, and the mediastinum contains the heart, and then also the thymus, some of the vessels of the heart. So since we just went over this, the heart is located in the B, mediastinum. Excellent. Ta-da. Good job. Okay, so we have abdominal regions next. These abdominal regions, again, we don't really use in massage therapy. Sometimes they're helpful if you're doing visceral massage, but we don't teach that here. So these abdominal regions, since I haven't given you a page number in a while, are on page 11. That's where we are now. You can either divide them into 4 quadrants or 9 regions. The abdominal regions are named for their location. So we're going to discuss this for a second, and then it'll make a little more sense. Let's start in the center. Ta-da, right there. We're in the center. The center is the umbilical region, and actually on page 11, it shows you all of this information. It's a nice little chart for your reference. So the umbilical region, of course, is where we have our umbilicus, which is our belly button. So right in there, we have some small intestine, some large intestine, and a little bit of the stomach. Okay. Now, if we go directly above the umbilical region, we have the epigastric region. If you remember, epi means above or upon. Remember way back in midterms, epi means above or upon. So this is above the stomach, epigastric. That's the name of this region right here. Gastric refers to stomach, or gaster refers to stomach, actually. It's Latin for stomach. In this region, you have a lot of the liver, some of the stomach. That's about it. The liver's huge, takes up a lot of regions. All right, so if we go below the umbilical region, we have the hypogastric region. Now remember, hypo means below. So hypo, below, gaster, stomach. We have an area below the stomach. And the hypogastric region has mostly small intestine and some of the large intestine. It actually has the end of the colon there. All right, so these 3 make sense. Cool. All right, well, let's go on either side of the hypogastric region. So here we have which side of the client's body? Yes, it is the client's right side. They're opposite. what we're seeing, so it's their right. Okay, so what we have here is an area that is near the ilium bone. Okay, so we have the right iliac region. That makes sense. So this is the right iliac region. We have a little bit of large intestine, some small intestine. This is actually the beginning of the large intestine right here. It's all intestines, really. It's a lot of intestine. All right, so if we go over here, we are at the left iliac region. And the left iliac region has, again, more small intestine, some of that descending colon, a little bit of the sigmoid colon, and that's about it. Okay, so we know these, they make sense. Okay. Now, here and here, on either side of the umbilical region, let's go back over here. We are on what side? Right. That's right. It's the right side. Okay, so we are on the client's right side. Now, we're not in the ilium anymore. Where are we? Yeah, we're basically in the lumbar region. Yeah, if you were to turn the person around, you're working on their low back, right? So these are the left and right lumbar areas. So this is the right lumbar region. This is the left lumbar region. And again, it's mostly intestine. Now, if we move up one on either side, here we are, here we are, here we are. This is a little different. So this is actually the right hypochondriac region. Now, hypo means below, right? Who remembers what chondro means? Cartilage. Yes, chondro means cartilage. So hypochondriac means below the cartilage. And what cartilage are we below here? Exactly, we're below the rib cartilage. So this makes sense. Hypochondriac region. We are below the rib cartilage here. And in the right hypochondriac region, we have a lot of liver. It's pretty much all liver. There might be a teeny tiny bit of gallbladder there hiding behind, but it's very livery right there. If we go to the left hypochondriac region here, we have just a tail of the liver there, more stomach. There's going to be a spleen over there. It's going to be a little bit of pancreas. You can't see any of that here, but that's what's in those different regions. And really just the names of the regions are what I'm interested in you knowing, because it makes sense once you think about the root words of each of these different descriptions. As I said, we can also divide the abdomen into quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. These aren't used by massage therapists. Physicians, yes, for assessing things, like in the right lower quadrant, there's McBurney's point that's used to assess the appendix, but it's not in our scope of practice. But they are there. Okay. Now, the last thing that we're going to go over really is homeostasis, which you already know. Homeostasis is a state of dynamic equilibrium, which means that it's not static. So it's always shifting and it's always trying to maintain an even keel. You know that the body operates within a pretty narrow range. You're familiar with some of these ranges, like body temperature being roughly 98.6 degrees. When we go above that, things don't go so well. When we go below that, that's really okay for a little bit until we get too cold and we suffer from hypothermia. But we also have homeostatic mechanisms for regulating blood pressure and fluid levels, hormones, different types of chemicals within the blood itself. So there's a lot of different homeostatic mechanisms within our body. Now, the key here is really how our body does this. Mostly, it's a negative feedback system, and this is on page 13 in your book. So really what happens is some kind of receptor on a cell detects a change. Let's say it's body temperature. Okay, so we're going to say that it's cold, and the skin cells detect that it is cold. Those receptors send a signal to your brain saying, we're a little chilly. The control center, which is the brain, receives the information and processes it. And then it sends a signal out an effector to an effector organ, usually. And this is the feedback. So what's going to happen in the case of you being cold is that you will start to shiver. You'll produce muscle contraction. Muscle contraction generates heat. You start to warm up. And when you start to warm up, your brain is going to receive the signal that you are now warmer, and it's going to shut down the change. That's negative feedback, and it works very much like a thermostat in your house. Once the body reaches a certain temperature, or once your house reaches a certain temperature, your heat shuts off because now it's warm. It's detecting that it's warm. The body works the exact same way. And again, this is negative feedback. So once the body reaches a set, whatever it happens to be, then your body shuts off the change. There are times where your body goes into positive feedback, but not a whole lot. One of the best examples of this is during childbirth. So when a woman is in labor, what is really happening is that her body is increasing the stimulus. So it's increasing the intensity of the contractions until the baby is born. Normally, your body doesn't want to do this. It doesn't want to increase the intensity of the stimulus because that will send you way off homeostasis in the other direction. So again, positive feedback isn't used a whole lot in the body, but that's one of the examples. Negative feedback we just talked about. You can read these slides if you wish. It's the same thing that's on page 13 in your textbook. There is an animation on Davis Plus about negative feedback. So again, if you have the book and you have the code, you can go on, set up your account, and you can do all of the review information, or all of the animations and all of the review questions that are on there for this chapter, because you'll have student account. How does the body maintain equilibrium? That's right, homeostasis. Homeostasis is dynamic equilibrium. Okay. That's it for chapter 1. Yay! I'm sorry that the video was a little bit longer, and none of the other videos will be this long. But I really wanted to get through chapter 1 in just all one shot because, like I said, it is mostly review for you. Now, the next set of videos is going to focus on chapter 2, which is chemistry. This is basic chemistry. I will not be asking you to balance chemical equations or do Louis dot diagrams or anything like that. It's basic chemistry, chemical bonds, the chemistry of life. And I have some really fun videos for you on D2L about different aspects of chemistry. One's a TED Ed lecture that I'll talk about. So that's it for chapter 1, and I will see you soon.